my name is Pratiksha and I am hostel student at Confederation College pursuing Developmental Services Worker Program, and today I will demonstrate how to administer the medication mm, properly in a safe way. So it is important to follow the advice of the medication to ensure the safety and the accuracy. And the first step, we have to make sure the health hygiene and the preparation. So first of all, we have to wash and sanitize our hand while approaching the medication cupboard and gather all the necessary supplies like medication, mark sheet and gloves and a cup of the water. And do not touch any medication with the bare hands, and use the gloves, a medication cup and a spoon if necessary. If we are feeding the medication with a spoon, then a spoon is necessary. And check the medication level carefully, and we have to make sure that we have to check the medication expiration date also. And we have to make sure that we have to compare that medication with the mark sheet to ensure the accuracy. And after that, we have to identify the individuals. So for identifying the individuals, we have to check through two identifiers. And first one is we have to check them through their name and date of birth, and second one is we have to check them by their photo. And then what we can do is we can explain what medication we are given to them and what is the purpose for the medication administration. And then we have to follow the advice of the medication. So the first one is right person. So we have to always make sure that we are giving the medication to the right person. And second is right medication. So we have to, as I already mentioned, that we can identify the individuals by using the two identifiers, that is date of birth and their photo. So after checking the individuals is correct, and then we can match the name with the mark sheet, and we can give them the medication. And then third is the right time. So we can always make sure that we give the medication in the right time and with the right dose. So ensure that the correct dose is given to the person. And after that, we have to give the medication through the right route. So route of the administration, someone take their medication. Some medication are given by the oral route, some medication are given by the sublingual route, and some medication are given by the topical route. So it depends upon the medication and the person. So after that, we have to document the medication properly, so it falls under the right documentation. So record the medication immediately after giving it with proper time and route of administration. And after that, we have to make sure the right reason. If we are giving the PRN to a person, if necessary, then we can document it properly. So if I am giving a lorazepam or suppository to any of the individuals, so I have to document it properly, that at what purpose and at what time I give the medication to the person, and the right response time. We have to monitor that if the medication work or not, and did they feel any headache after the medication, or any nausea or dizziness after the medication or not. So administering the medication, so give the medication to the correct person through the correct route, such as the oral, sublingual, topical route, etc. And if the crossing or mixing is required, then we can do crossing or mixing as per as the mark sheet instruction. And we can provide the liquid so that it helps them to swallow the medication properly. And what we can do is we can just mix the medication in the applesauce or yogurt, so that it helps them to swallow the medication properly. And then after after that we can see that we can see they swallow the medication properly or not. And after we administer the medication, we have to observe the individual's immediate reaction, and we have to wash our hand again after administering the medication, and we have to document the medication properly in the mark sheet with the time, route of administration, and date of administration, and the observation too. And if the individual refuses to have any medication, or if we do any medication error in, then we have to document it properly, and report to the supervisor, or any institutional protocols, policy, or standards. We have to follow the institutional policy, protocols, or standard. So these are the following steps that helps to make sure that the medication is administered to the correct person and are given safely and accurately. Thank you.